You came into this life, brought up as an orphan child, through a time of deep despair. Oh Muhammad, your days at work began as a fair and honest man. You showed just how much you care. And one night in that cave, when the archangel came, and your life in this world will never be the same. Rasulullah, Habibullah, the light is always showing me the way. Rasulullah, Habibullah, I'm longing for the day I see your face. You brighten up my day, and in my heart you'll stay. With every breath I take.
Hey, Bismillah ar-Rahman ar-Rahim and Assalamu alaikum. Welcome to our latest installment in our series of Zoominars where Cornerstone Law Services provides legal and financial tools for Muslim families. It's our way of making legal and financial tools understandable and accessible to all of you. We have been bringing in experts in many fields relative to our unique situations, which we hope will allow you an opportunity to learn from and ask questions from people who have extensive knowledge in areas that are important to you. So this week, actually, in previous weeks, we brought in experts in finance, wills, trusts, insurance, and economic trends during COVID. But we've decided to take a pause on finances and address a very important subject to all of us, and that is our children. So as schools are debating whether or not to open, we are obviously concerned as parents, and we're worried about the risks that our child may contract COVID. We want to see how do those symptoms show up in our children, and when do we have to take them to the doctor, if inshallah never, but hopefully, if we do, like what to look out for. So today we have three well-known doctors in our community, and we have Dr. Ibrahim Umerji. He's a pediatric specialist in Bakersfield with a lot of experience, and he completed his residency in Long Island, New York. And then we have Dr. Shema Khan, and he has done extensive work locally and abroad, and he teaches at UCSF, Stanford, with a focus in orthopedics, trauma, and sedation. He's actively practicing pediatric emergency department physician over the US and also here in Southern California at Kaiser. And we have Dr. Qadri, who's an assistant professor of neonatology at Loma Linda Medical Center, and he's a board certified pediatrician. And so please post any questions you have in the Q&A section, or you can email us at info@cornerstonelawservices.com, and we'll respond with the answers as soon as possible. And also please check out our website at Cornerstone Law Services. And as usual, I need to emphasize that the purpose of these webinars are for educational purposes and not intended to be medical or legal advice, and to please contact a legal professional to develop a proper plan that's right for your personal situation. And so I will leave it now to Dr. Umerji.
Hi guys, assalamu alaikum. I hope you guys are doing well. Today's talk will, it won't be a lecture like normal. I mean, we will present things, but we'd really like it if people will chime in. The panelists would chime in, explain their experiences, and whoever's listening, please feel to interrupt at any time and ask questions, because that's probably the best way to learn. So now just give me a second. I'm just going to upload the quick PowerPoint I made, and we'll go from there. Just give me a few minutes. I'm just running into some issues I didn't foresee here.
So Ibrahim, you can share the screen, right? From the, do you want to do that with the
Yep,
button at the
that's where I'm
bottom?
running into issues. So just
Yeah.
give me one sec. All right, can you see my screen?
Mhm.
All right. All right, so, for everybody who's listening out there, coronavirus is extremely common. I mean, everybody's had it at some point, multiple times in their life, and there's a lot of different strains, and most are mild, but every now and then you'll have this crazy mutation, and SARS and MERS, you've probably heard of in the news in the past, but um, yeah, those are like the surly members of the family that nobody wants to talk to, right? So coronavirus is a nice family in general, as viruses go, but every now and then you have these really angry people that you don't want to deal with, and that's what we're dealing with. So think of COVID as the family bully. Um, there's been a lot of talk on how it started and all that, and who knows for sure exactly what happened. But either way, it's something that's very present in our community, and will continue to affect our lives, um, at least for the near future and possibly for the longer term future as well. So in the starting, no one knew what to expect. We really didn't know. We modeled a lot of our information based on what we knew about the flu and other coronaviruses, and a lot of that didn't prove to be correct. We thought children would be, a group that we'd have to worry about a lot more. And as we know, it's really not the case. The spread, we really didn't sure, was it aerosolized, meaning did it spread in the air versus did it spread like little droplets when you speak or through touch or whatnot. And then in the starting, because we didn't know, there was a lot of conflicting information. Should we wear masks? No masks. In the starting, the CDC said masks don't help, but then eventually mask is a big part of how we're going to control this thing. And so, that was probably frustrating for a lot of people and probably led to a lot of mistrust within, you know, within our medical community and in the treatment of it. And as time has gone on, we've sort of learned what works, what doesn't work. But in the starting, we treated a lot of this like people who had the flu.
So Ibrahim, go back one if you don't mind. Can I ask questions? Can we ask questions that kind of
Yeah,
go
please,
on
anytime, please.
to all three of you? Really, I think one of the primary means of controlling this has been the mask wearing scenario, right? But with children, how do you guys find anything more effective than another to get them to wear the mask and keep it on, particularly when it comes to children of younger age in school?
So surprisingly enough, from my patients and what I see in my clinic, in my office, kids have been really good at wearing masks, even kindergarten age and up. Now below that, it gets harder, and I don't see that happening consistently. I don't know if anybody else can chime in.
Yeah. So what's the alternative to that? Because as we know, kids tend to, especially with the flu or with colds, right? They tend to share a lot with each other and with their families. So as much as often we talk about kids maybe not being as vulnerable or as recovering, but the scary part is if they start to mingle too much, then they go bring it home, and not just to their parents, but grandparents, right? And other folks.
So if I can chime in right now.
Yeah.
Ibrahim, thanks for the intro. Definitely, Sana, I hear you. That's the $1 million question, right? How do you prevent a spread of any infection to anyone? So I think the basis of this is the number one thing that it goes down to common sense. common sense. You don't put your child in a situation where there's other sick children. So one of the big things a lot of times I encounter in the emergency department are parents that have children in daycare.
Mm.
What do they do? And how do they treat this? And Ibrahim, you probably get a plethora of patients that always talk about, do I send my kid to daycare? Do I not? And what are the guidelines to put them back in daycare? And this is one of the things. So a lot of times what my advice to a lot of patients is the first thing is build yourself, build your child, right? Improve the immune system, improve the things that you're doing, the first line of defense. As we all know, prevention is better than cure, right?
Yeah.
So some of the things that I do is go down to the basics. What is going on? Because of COVID, I think it's thrown all of us off track. And so a lot of the challenges we're facing right now is we're having parents that are trying to reemerge into society, reintegrate, and now the children have kind of been left in limbo. Go to school, don't go to school, go to daycare, don't go to daycare. Are we still in quarantine? These are a lot of questions that a lot of parents have. And I think the challenge becomes with that is giving them the right advice. So a lot of times I tell families, I go, practice the first thing is practice common sense, right? If your child is somewhat exhibiting signs that he's not feeling well, don't put him back in school. Don't put him back in daycare. That's the first thing. Second thing is, what is your diet like? How do you feed your child? What are the kind of things that you're doing? Are you feeding them healthy? Are they, in Southern California, we're on an epidemic of abdominal pain and hot Cheetos and Takis with children. 30% of children showing up in an ER are related abdominal pain with hot Cheetos and Takis. That's it. Their fingers are stained. So kids are addicted to sugar and salt, the white powders, right? So I always tell them, stay away from it. And that's a great rule of thumb for all of us. You stay away from the white powder, period, right? But we're human, so kids require a little bit, but what kind of ingredients you're putting in? Are you feeding them healthy? Are you giving them a lot of food that boost your immune system? I always talk about zinc supplementation. As we all know, that zinc is the only known thing to kind of prevent a cold. So, like the zinc supplementation, between 3 to 5 milligrams, 8 milligrams, 10 milligrams a day. I've been taking zinc from the beginning of this whole pandemic. And I'll tell you, alhamdulillah, being in a frontline position, taking care of patients, diagnosing patients with corona, alhamdulillah, I have not gotten sick. Been taking zinc and also a combination of turmeric and some black seeds, and we also know the sunnah with regards to some of these things.
Black seeds, yeah.
So, I think the first and foremost thing is to maintain spirituality and iman and understand that, first to exercise common sense. I think, Sana, you've distributed quite a bit of information about exercising common sense, right? So that's the
Sometimes
first.
I find common sense is not that common.
Yeah, it's uncommon.
It's kind of
It's very uncommon, right? And so that becomes one of the biggest challenges. So that's after we tell them, building them up from the beginning, mask versus no mask, kids, the masks are, they don't stay strong on their ears. Kids are eating, they're talking, it's bothersome, they're ripping it off. Some children are fidgety. So it becomes hard to do that. And that's when it kind of goes back to, did you do the right things in the background, building the child's immune system, making sure they're in a healthy environment, they're resting well, they're sleeping well, their diet and everything is together, exercise.
Well, that is actually, I've done a lot of these seminars on COVID.
Yeah.
And in terms of kids, it's you're absolutely right. Because I've had people say, doctors say like, oh yeah, you got to train them how to put the mask on right. And you got to make sure that it's keeping fit, buy them a better mask and this and that. But you're 100% right. If you can get them to build their immune system better, keep them less stressed. But I think we could go back a little bit also, right? Because if we can start teaching the kids hygiene earlier on, you can actually get them to do that, right? And we should ask our schools and our teachers. I think as parents, we have to become much more proactive, right? Like you said earlier, better to have prevention than cure.
Correct.
So as parents, if we can actually teach kids that they need to wash their hands more often, right? And you can teach that to young kids. I don't know, Ibrahim, if you I don't remember any more kids at that age that you have, but can you get them to wash their hands pretty okay? Like, are they, they okay to do that, or do they learn?
Absolutely. Kids, they learn pretty quick and they follow by example. So if it's something you're doing, kids will almost always pick up on it.
Ibrahim, I'd like you to continue your talk, but just the thing that what challenges you face as a pediatrician, Shema sees them in the front line, and what you follow up with is the, how are you going to get a 3-year-old to wear a mask, or obviously 2-year-olds are going to be impossible. And that becomes a challenge in itself for families and parents. And that's not obviously my concern. I'm sure somebody will address this. It's not so much the 2 or 3-year-old getting sick, but how you're transmitting it to the people who are older. And that becomes a challenge. I think that's the most difficult thing.
The other thing, Manaf, what we don't know is what are the effects of COVID? So the long-term effects, right? So people are focused on, okay, it's the elderly that are dying and the young ones are not, but death isn't the only thing that we should be focused on with COVID. What we should be understanding is that it affects, the nasal mucosa, right? So that's why a lot of people lose this sense of smell. It affects even the taste buds, right? Like that, and is it affecting, the hypoglossal nerve? I mean, is it affecting the auditory canal? Because there's people that are talking about that. So, and maybe, Manafa, you can kind of reflect on that. I don't know. I mean, I'm not a pediatrician, but are kids more vulnerable to those kind of things? And then maybe long-term effect, we don't know, right?
I think that's a very good question. And, in terms of what do these guys see in clinic, I think the long-term issues become, the clotting defects, or, are we having aneurysms like we did with Kawasaki on these kids? And that's an interesting thing to follow up. And what kids who had Kawasaki got admitted and follow up was they're having aneurysm of the coronary arteries. And that's the big concern. What's happening with the young athletes who are having COVID, and what's the follow-up in terms of their contractility and how is that affected? So I think those are interesting questions. I mean, I don't want to interrupt Ibrahim's talk, and so I think let us have him continue, and we can bring those questions up later if Ibrahim wants to continue.
Yeah, but definitely please bring those points up, because I want to tell you guys exactly what to look out for, when to be concerned, and what kind of things, the complications you should see.
Yeah,
Absolutely.
We'll get to those. I mean, yeah, definitely. This is meant to be discussion, so this is great, actually. So real quick, you guys all know this. We've learned how to treat, which medications work, which don't. We've known some of our leadership have pushed medications that really have no basis or can be harmful. But we sort of in the last year, what we've learned, and it's been amazing as to how much information is out there and how it's being organized and distributed. It spreads mainly droplets. We thought touch was going to be a big thing. So things like that, who it affects, these are all things that are that we've learned. Now this is the data. Basically, this is as of the 29th of October, and we're just looking at the pediatric population here. So that's our pediatric population on the left, 75 million kids, and we've had 7.6 million cases, not just in kids, but all throughout the US. And out of those, about 850,000 were kids. So about 11%. So kids are getting it. We are definitely seeing kids get positive findings, and it's happening, fairly quick, frequently. But then on the flip side, yes, people are getting sick, but the important thing is how many people are having severe outcomes from it. How bad is it? Because, everybody gets a cold also. So the moral of this story is in kids, the mortality rate, the severe outcome rate is really low, actually, compared to adults. And just in general, I mean, last year, the flu took 188 kids, we think, around, as per the CDC. And so you compare that to COVID, and so far, the cumulative child deaths in the US that we've attributed to it is 121. And yes, that's sad, it's tragic, but you look in the big picture, and in the big picture, it's a tiny, tiny number. So something to keep in mind as we go forward with this thing. And in California, as of last week, or about 2 weeks ago, we had 2 pediatric deaths so far under the age of 18. So again, sad, each, but big picture point of view, it's still much smaller than adults.
So, Ibrahim, if I could chime in, a lot of those deaths also have to deal with children that have underlying comorbidities, A lot of those children had pro-inflammatory processes already working in their body, right? And so be it an underlying disease such as asthma, be it an underlying disease such as cancer, or something that's requiring chronic steroid therapy, or someone who has an underlying process with their lungs. As you know, Munaf, I think you could talk about like the underdeveloping lungs, right? With preemies, which is a very common thing we see all these days. And so these children are a little bit more prone for reactive airway disease and illnesses of the respiratory tract. However, the vast majority of these deaths that we talk about, you know, although unfortunate, the vast majority of them have some underlying comorbidity. So if your child typically is relatively of good health, fully vaccinated, you know, your fear can come down, but I mean, it doesn't go away completely, right?
If my follow up with Ibrahim is that how are your kids who have asthma and other comorbidities, I guess reactive airway disease, what are you seeing? Are your numbers have gone up, or is it because so many wearing our mask? And I guess it would probably, let me ask Ibrahim first and then Shema, because you see these guys in the front line too. How are your kids done? And I guess what are the numbers looking like in Bakersfield specifically? And I know Shema, you're all over the place, so I have an answer from both of you guys, you know, with your experience.
Shema, want to go first, or?
So yeah, I mean, I've been practicing all over Southern California as well as in Houston and in the East Coast during the midst of COVID. I was actually deployed to Houston as a emergency medical service worker. And I will tell you that couple things. I have not seen an uptick of respiratory disorders such as asthma flares, you know. Typically you would see this around this time, which is very important because around this time now, you're going to have the introduction as the weather has changed, the temperature has changed, you're going to have more RSV, you're going to have more influenza. Now with those coming in, you're definitely going to see more of a reactive airway disease process, right? So a lot of these patients are going to definitely present that way. I haven't seen many, you know, and, you know, they talk about the nebulization process, the way we deliver the medication for the patients that have asthma, inhaler versus a nebulizer, you know, oxygen masks and things like that. I think the first and foremost is to kind of identify that, but I have definitely not seen an uptick of that is requiring treatment. There are a couple of patients that have required a couple of inhalers here and there, but nothing that I've admitted. No one that is going to the intensive care unit because of respiratory failure as a child. You know, the patients that I have taken care of corona that have had illnesses, usually it's a multi-inflammatory syndrome, right? So they have a new concept known as MIS-C, which is multi-system inflammatory syndrome COVID-19, right? And I think Ibrahim, you probably were going to get to that and complications and stuff like that, but that's usually what we see, which Munaf, you had mentioned a Kawasaki's like picture, which is an inflammatory process where all systems are kind of on board with inflammation. So I think you're okay, but with the masks, it's definitely diminished transmission. Absolutely. You know, we are seeing, and that's a known fact, but you know, in many other countries across the world, they've been doing this for decades already. It just came to our shores now. For example, China, you know, they've already been wearing the masks. So, you know, could it be the pollution? Could it be the viruses? But we know that the air is bad. And Ibrahim, you can attest to the Central Valley having the worst air quality in the US, Visalia, Bakersfield, and Fresno, you know, which it's horrible. The day it rains is asthma day, croup day, right?
Yeah, it's true.
I'm sorry. So I know, like you were saying about children who have underlying abilities have more of a chance to have a worse reaction. But so, I mean, most of these things, the parents know what their kids have, but is it also a possibility that they don't know that they might have these underlying abilities? I mean, a lot of them are like asthma and diabetes, like things that they would know, but otherwise.
So if I may, I think that's a wonderful question. First of all, I think even the vast majority of COVID-related mortalities of patients that don't have anything, they just show up and they're, you know, a statistic for a death. I personally, my personal bias is there's something going on in their body that they just don't know about, you know, and boom, this comes and causes a surge of inflammation that they just cannot handle. Be it a weakened immune system, be it something that they have an underlying process. Allahu alam, you know, I'm not sure. But the vast majority, it's kind of hard to say who's at risk, but we're talking about patients at highest risk, right? these are the patients that we need to be tread carefully with. But the vast majority, the general population, I think you're okay unless, and you know, there's subtle signs in children that you can, and Ibrahim, you can elucidate that, you know, that like a lot of the patients, they don't grow properly, they have an underlying process, and we catch it at an early age when, you know, when Munaf and Ibrahim have both done their job, they don't come to me, you know.
You know, in Bakersfield or in the Central Valley, because of our asthma, I mean, because of our air quality, we have correspondingly high levels of asthma and different lung issues. And, you know, you would expect around this time of year, as Dr. Khan was saying, that, you know, you'd see more asthma exacerbations and, you know, just general problems with asthma, cough, colds, things like that, that, you know, require a little bit more than just watching at home. But by and large, we haven't seen that. And
I mean, there might be a interesting side note here, though, Ibrahim, because I mean, the fact that everybody's being so cautious because of Corona, of course, that spills over into, you know, the flu virus not being able to be as effective because people are washing their hands a lot more, wearing masks.
I agree with that, but there's another point to it. The virus is definitely circulating.
Yeah.
And the numbers are definitely up there. I mean, but, you know, amongst my panel and among other Kern County, you know, pediatric patients, we haven't seen, you know, what we anticipated, what we thought. We really thought we would be really hit hard with COVID and asthma, because we have pretty severe, you know, cases, and these kids are getting it. They're getting it, but again, you know, they're not getting the kind of symptoms where you would hospitalize them for.
So Sana, you'd mentioned a overlap between flu, other respiratory viruses, and COVID. And Ibrahim, you definitely mentioned the right point. But I definitely think, yeah, these are standard practices. Period. You know, right. Flu, RSV, anything, the standard practice. Now with PPE, you know, it's still kind of ludicrous, because believe me when I tell you this, that despite all the stuff that's happened from, let's say, the early part of this year till now, guess what, guys? We still don't have the proper masks on the front line. So this is a conundrum, because it kind of makes you think, like, you know, what's going on here? I'm an ER doctor. Believe me, you know, one of my close friends, Asif, gave me my first N95 to go to work. My first N95 came from someone non-medical who got it from Amazon. This is the ugly reality. So if you ask if we need to be prepared, absolutely. You know, we do our things. I think everyone has their storage of masks now. And you talked about hand washing. I don't think there's anything that's going to, you know, like Ibrahim was saying, you can definitely train the children, but you got to make it like a positive reward system, you know? So like Ibrahim said, it starts from above, leadership. You got to set the example. When many of the parents are getting upset now, we're venturing out, the kids want to get out. They want to go play. They want to go do their thing. So now we put them back in parks, and now they're in different areas. So now do hand sanitizers come into place? Do this and that, hand washing, soap, all of this is definitely important. Never let your guard down, not just during respiratory, COVID or non-COVID, period. You have a lot of different bacteria and diseases out there that are very, very detrimental, but subhanAllah, Allah has protected us, you know? The vast majority of this does not affect us.
Question.
But yes.
Sorry. Hand washing versus hand sanitizer, whenever you guys have a chance.
Ibrahim, go for it.
Both are effective, I think. I think hand washing is probably better. Soap, definitely, soap and water is probably the best idea if you have 20 seconds. And but hand sanitizer is not a bad option, in my opinion.
Because I'm just thinking at schools and stuff, sometimes it might not be feasible to just have them all wash hands. So I'm just wondering if hand sanitizer is a good substitute.
Absolutely. Getting back to Ibrahim, tell me what you were saying, that it's there and the kids are not getting as sick. What do you attribute that to, especially in the Valley? Why do you think that's the case?
I think overall, as I stated earlier, that, you know, because we have been in quarantine a little bit longer than normal viruses, you know, we haven't seen them circulate as much. We don't have great mask. You know, people don't, you know, over here tend to be a little bit more Not on board with public health recommendations, but and a lot of our schools have opened already. So the reason I think the reason we're not seeing our normal bugs is because we haven't kids haven't been around as much with each other.
Your COVID numbers haven't gone up with schools being open in kids?
We've seen a small uptick.
Okay.
We have seen a small uptick, and we anticipate that's going to get higher. But we haven't seen a corresponding increase in hospitalizations.
Absolutely, and I will second that. Being one who's actually checking these patients and drawing the blood, drawing the test, that there's a slight uptick, but in terms of comorbidities and seriousness, we're discharging these patients home. So when they are sent to the emergency department, I send them right back to Ibrahim, and I say, "Hey, Ibrahim, you're doing a good job. That's all that needs to be done."
Shima, who are the kids that you're actually testing? Because I assume you're not testing everybody. Are you testing kids who just have
Great question. What are the actual recommendations for testing?
significant hypoxia, or only testing? Because I assume that you have kids with, gastritis, this issue, that issue that you're not testing. So who are you actually testing?
So, the actual departments, the recommendations, Kaiser and non-Kaiser, when patients present to the emergency department, what are we testing? We're testing anyone that's sick to be admitted. That's first thing. We're testing anyone that's coming into the hospital for any procedural, such as a pre-op, or, they're coming in for routine, something like that. For example, like a routine surgery, or someone who's coming in for an active infusion of chemotherapy.
I guess my question is that what are you testing in ER, right? Because you're not getting the pre-ops in the ER. So who are the—
Actually, these are all ER. All of this is ER, because pre-ops, meaning we're diagnosing them, and we're sending them. And so a lot of patients, for pediatrics to adult medicine, it's a little bit different. So a lot of times in pediatrics, they send them through the ER, but the vast majority of them are, you're sick. If someone's coming to the ER saying, "Can you test me?" we don't test. If Kaiser patients present to the ER and request testing, we may test them, but the test result will not come back for 2 days. And we're testing them basis on just because they want to know. But the vast majority of the general public are not getting that liberty.
Do you think the numbers are higher than what's in the kids than what we are seeing, what we're reporting, just the fact because you're not testing everybody?
So I
leading question, I know the answer. I just want both of you to respond to that.
Yeah, so my personal bias is the numbers are highly inflated, right? And a lot of that has to go with just the virus from the beginning, from the mass uncertainty to everything. You have patients that are being tested across the country that don't even have symptoms, that don't even need to be tested, but now they're becoming a statistic and a demographic statistic. I will tell you in my own personal process, because I had to travel, I had a positive corona test, no symptoms whatsoever. 3 days later, had another test, which was negative.
Mm-hmm.
And it's just behooving, the quality of the sample that is being taken, who's testing, how they're testing, why are they testing, So some of these things become a little unusual, because now it's like you're labeled as corona positive in your net, and then you go in this database registry where they're calling you and doing contact tracing, and et cetera, et cetera. But I think the numbers are inflated. What's being shown to the general public is definitely inflated. What I'm seeing, it doesn't match up. It doesn't match up.
That I don't think necessarily they're inflated. I think we're not testing everybody. So the numbers are probably out there in public. The question becomes how many of those people are symptomatic. My question was that to both of you is that obviously you're not testing everybody. There are tests that are false positive. A lot of them, depending which one you're doing, PCR or non-PCR or the antigen test. But I guess my question to both of you is that, you guys see kids who have cough, cold, or gastritis or something. You're not testing all those kids necessarily.
So I tend not to test. When people do call asking to be tested for their kids, whatnot, even if they're showing symptoms, I tend not to, because it's not like a strep test where it's a positive test you act on. And, like we're talking about the accuracy of tests, especially in kids, getting a good sample, especially when kids are struggling, moving, a negative may not mean negative. And so it's hard to interpret the results. And so generally speaking, I don't test. If you're exposed to COVID and you have symptoms, I've been telling families just treat it as such, 10 days, 14 days.
There are parents and teachers in the audience. Okay, Brian. So if you were to, not if, what I like for you, actually both of you to do is to tell us as parents and teachers, when should I elevate the situation of my child to bring them into the doctor's office? In other words, when kids get sick, and at least my kids when they're growing up, we didn't take them to the doctor right away. I mean, you kind of hung out with them, gave them some medication. I mean, so Sephora took care of it mostly. But my point being is that we didn't necessarily jump to go to the pediatrician.
So we'll get there in a second, but real quick, quick signs and symptoms. It could be anything. It could be from
Oh, I
nothing
see. I was one slide ahead of you. Okay.
to everything in the book, right? And they did the study where there was an outbreak at this summer camp in somewhere in the Midwest, Wisconsin or something like that. But and so these are the most common symptoms they saw, at least in kids. The smell and taste wasn't as common. The loss of smell and taste was not as common in kids as it is in adults. These four were at least in this study, were the highest or were the most frequent symptoms: cough, fatigue, headache, and sore throat. I say, so what to watch out for? What worries you? So, any disease or illness, especially in kids, it's hard not to, think of everything, but you actually look at the child. I mean, several things obviously if the child's looking more tired too, not lethargic, like when your wife tells you to do something lethargic, but actual lethargic, like you can't get out of bed, that's one thing. Dehydration, obviously.
Program, don't talk about the husbands, please.
Any worsening symptoms, but I tell parents that it's your instinct. You know what your child is sick. You know if you know them the best. If they're really that far off their baseline where it really worries you, that I would bring them in regardless. But people ask about how high fevers should go. Fevers can go high. It's really, kids with high fever sometimes are fine, and sometimes kids with low fevers are the ones sick ones. So again, how does the child look to you? How they respond to medication? How are they? How do they just look in general? That's really the most important thing. But anything that concerns you can be worrisome, and you know your child the best. So that's my usual take on it. But
so if I could chime in, Manaf, to just answer your question, like I told you before, the ones that are being tested are the patients that are just being admitted, and any pre-op that's coming to the ER, that's all just for segregation and not, corona positive, corona negative. With regards to testing, I absolutely agree with you, Ibrahim. I always tell parents, I go, if there was a treatment for this, I would test for it, but the vast majority of it, believe it or not, I think the vast majority of the population has already had the coronavirus, that's one thing. The second thing is, as we know, there are 3 different strains floating around right now that have already mutated. The vast majority of kids that are getting coronavirus right now are presenting more with GI symptoms, abdominal pain, vomiting, diarrhea, rather than respiratory symptoms, more adult related, pro-inflammatory, high fevers. The vast majority of kids I've seen that have corona positive, a little runny nose, a little bit of cough, not too bad, just a little bit sick, like a cold, So my take on that to a lot of parents is, if there was a treatment, let's do it. I have no problem testing it, but assume it's positive or negative. It doesn't make a difference. And the result will not come back for 2 days. So that's the challenge.
Well, but don't you want to keep that kid at home? Like, if a child is positive, do you want to isolate them from school?
So great question. Any child that has a fever for a minimum of 24 hours, Ibrahim, please chime in on this AAP recommendation, but I believe 24 hours, you cannot return back to any gathering where there's other children, school, daycare, whatever it may be. But the problem is, when the kids are off now because of COVID, kid feels fine, we're going to ignore this challenge. And then it's a perpetuating cycle, We're like, it boils down to the common sense factor. When your kid's sick, stay at home. It's simple. It's the better way. But I think that's one of the things, is trying to understand when to reintegrate, so I believe the first thing is there's no fever. If there's no fever for a few days, that's when us as pediatricians kind of chime in saying, yeah, that's a good sign, There's going to be a little bit of cough, a little bit of runny nose, wear a mask,
But okay, so at what point has the child recovered where they're no longer contagious? Meaning that somebody, let's just say we don't test, right?
Okay.
A kid gets sick, we don't test. After 5 days, fever gone, feels healthy. Is that child no longer infectious to other kids? Can he go back to school?
So I personally release them back if they're afebrile, if they have no fever. coughs and colds are very common things. We cannot treat them, and they're the bread and butter of pediatrics. Ibrahim, what are your thoughts?
I tend to agree, because we get cough and colds here all the time. I mean, that's going to happen. And the minute kids go back to school, all these viruses, like we were talking about, we didn't see, they're going to start circulating again. So, and yeah, so usually officially, if you really want to look at a person with COVID, if they have COVID, it's 10 days from the beginning of symptoms, and then 24 hours after all symptoms resolve. So whatever comes later.
Okay, that's a specific
officially.
answer.
That's if you have COVID.
Yeah.
That's if you're positive tested.
Exactly.
I'm just going to follow up. Okay. Yeah. Go ahead, Dr.
Henny, you have two kids that are young and they're going to Minaret, and we just found out right at Minaret that we had two kids that tested positive. The whole school pretty much shut down. It's like everybody was told to go home, and all the kids are no longer coming to school for the next 2 weeks, and I'm on the board, right? So we're spending God knows how much money in all the sanitation and just cleaning up and having a crew come in. I mean, is that like all an overreaction, Shema, Ibrahim? I mean, it's like, well, how should we handle that scenario where, again, two kids tested positive? The parents, unfortunately, like they didn't tell us, like the kids kept coming to school, right? And then the only way that the principal found out was, from what I understand, is when the authorities called and said, hey, you have two kids that have tested positive. What are you guys doing about it, right? And so given that scenario, what is someone like Hanny supposed to do?
And this is a great question. I'm just going to follow it up because as you mentioned, Dr. Sena, we have few Islamic school admins, teachers listening, and obviously parents. So what are the type of measures like schools need to take in this case? Exactly. Just follow. That's just following on that. And I know it's for educational purposes. We're not, obviously each school has their own CDC guidelines and they have to follow that. But what do you think is a reasonable standard?
I think it's challenging. I think it's very challenging, and I think
yeah. So I'm going to come back to that and see if you can answer it in another way. Ibrahim, you're saying that after their afebrile, which to the audience, it means patient no longer has fever, or the child no longer has fever. You're saying 24 hours after they no longer have fever, then they're okay to move about the country?
So quick question. This is a general guideline for any child, any time that is febrile, COVID or non-COVID. Right, Ibrahim?
That's correct.
Okay. So second thing is, this all kind of boils down to common sense. The onus is on you. What is your honorability? If you have a child that is positive COVID, are you going to let your school know? That's the first thing. Second thing is that does the school shut down? What is going on in the entire nation right now? We're having an uptick. Elections went up. The uptick went up. Debts are going crazy, right? So it's definitely there's a mass uncertainty. When you create that uncertainty, you create fear. This boils down to Iman, having Iman and knowing that Allah is watching all these things and understanding that we're trying to do our best. Common sense. Your child is sick, positive corona test, let the people know. I'll tell you in my own honest opinion, when I tested positive for corona, again, asymptomatic, it was for a work-related thing. And so the first thing I did is inform the people I live with, elderly parents, and then I quarantined. And then I did the things I need to do, and I made sure they were okay. But that's the onus is on us as medical professionals, right? But when I had a negative test 3 days later, I told them, I said, well, wait a minute, this is positive, this is negative. What do I do here?
Yeah.
So I believe the onus is on the particular individual when it comes down to closing down schools and stuff like that. Example you gave with Minaret, that's a joint discussion with multiple officials, We go per the national guidelines, what the California state has recommended, and we follow those guidelines, right? If you have a positive outbreak, what do? This is what we do.
I think that it's a good one that I definitely follow the CDC guideline, the local health department guidelines, because the numbers at Minnesota are small also. If you had a school of kids of 2 that were positive in a school of 1,000 or something like that, it'd be a big difference. But the percentage for the amount of kids that are in Minaret is a lot lower and higher percentage. There are not that many students. So I think whatever they're doing is appropriate in terms of
But
shutting
it's a
down.
complex problem enough because these parents, right? If you think about it, there's both working people, can't afford to take 14 days off. They would, one either potentially lose their job or potentially just not get that earning coming in. And they don't have enough money to necessarily have babysitting paid for.
No?
It's not even the money issue. Often the babysitters don't want to babysit a child that is tested positive for COVID, right? I mean, these are complex questions and issues and people's lives. And yes, we could say, yes, you're being selfish by sending them to school. And I'm not agreeing or disagreeing with that. All I'm saying is that the extremely difficult question for a parent to answer when the other parts of their livelihood is being affected with.
So that boils down to when we test and when we don't test, right? So apparently these children were presented somewhere where they were sick enough, or the parents thought that my kids were sick enough, they needed to be tested. Someone tested.
I exactly agree. They weren't sick enough. That was the issue, right? So because they weren't sick, no one even identified them as being sick children until the authorities called and say, oh, these kids tested positive. So if you do all this random testing, you're going to get right?
Yes. But see, what I'm saying, Sana, is somewhere they got tested.
Tested, that they were symptomatic enough to get tested.
Yeah.
That's what you're saying, that why were they tested to begin with? And that's what Sheima's trying to say, that yes, they may not be overtly sick when they were in school, but obviously somebody tested them. That
So
led, and it's a very difficult thing, Sana. I mean, I understand like what you said, your families who can't afford to have kids for 14 days. What do you do? Unfortunately, and I think the school is doing is appropriate. I mean, you protected, obviously you have teachers who may be ill, the teachers who are older, somebody may have immune issues. So it's difficult, but it's for the greater good until at least, obviously you guys are going by the guidelines and whatever the state dictates, which is the best thing that you could do. And not an easy answer or simple answer.
Let me just chime in real quick. This testing, non-testing thing, everybody's got a different take on it. But I'm telling you guys, this is what it is. Testing or not testing, it's not going to make a difference. If there's a treatment for it, let's test everybody. Let's get everybody. Now, when the argument comes in testing versus non-testing becomes, who do we keep away? Everyone's going to get it if you've already not had it. Everyone. This is a known fact. Now they're going to see now the COVID vaccine's coming out. Who's the front line? Everyone's going to get it. So if you haven't had it, brace yourself. You might get it. It might be a little cold, it might be asymptomatic. So that's when it comes down to testing, no testing. I mean, what are your other, so what do you thought? What do you think about that?
Well, I think Ibrahim, please, Ibrahim and Sana, go ahead, please. I think Sheima, you have a presentation to give us too, so maybe Ibrahim can finish up. And did you want to present?
Yeah, we'll finish and then we can because those are conversations that are being discussed at the highest levels too, and there's no right answer.
Fauci called me.
It's hard.
I think
so going forward, treatment real quick. This is treatment. This is Desi Mom treatment.
Mom.
So.
Okay.
There is no treatment for COVID. We know that. We treat symptoms. You have asthma. If you're having asthma symptoms, you treat it for asthma. If you have fever, you give Tylenol, Motrin, fluids, things like that. There's no specific treatment, at least on the outpatient side, for COVID, especially in kids. Lemon, ginger, over here, and at least in my family and in the Hispanic community, Vicks seems to be a huge thing. You slather with Vicks. That I guess helps. And then, I don't know, everybody wants antibiotics. That's usually.
Our audience think Desi Mom treatments work. So
that's actually Ibrahim's mom. So
probably.
So I have a question here from Nadia Shabir. She's asking, what if a parent is positive, child tests negative? The child is told to stay out of school for next 10 days, but parent is not quarantined from the child. Should the child be tested again before returning to school?
No. A couple things. First of all, the testing is traumatic, as everybody knows. It's a nose swab. It's pretty mean, and it can cause nosebleeds and all kinds of things. So number one. Number two, there's the whole false negative, false positive thing you got to keep in account. You can't take the strength of a test and just say that person is negative because they tested negative. It doesn't, you can't say that, especially in kids. It seems to get more inaccurate. And then number 3, after 10 days of, or 14 days, 10 days of being around that person, you shouldn't be infectious at that point anyway. So we would argue, at least I would argue against it.
So first thing is, you know, there's a question before that, but I just wanted to state, if the parent is positive, the child tests negative. If the child is negative, they cannot be mandated to stay out of school. There's no symptoms, right? So that's one thing. If there's a negative test, but you know, so absolutely, if a parent or a family member is positive, I mean, we see this with mothers all the time. Allahu alam, you know, and subhanallah, how Allah gives the mothers an immune system to take care of these children. Flu, RSV, it doesn't matter. These moms come to the emergency department like brave warriors, brave people, because they don't care. The only thing that matters is that child. And you know what? Look at their immune system. They're fine. So I think if the test is negative, I don't think they should be mandated to stay out of school. And I don't think that's you're following the guidelines. You know, just continue to maintain social distancing, washing your hands. And I think they should not be asking for a negative test again in 10 days if it's already negative, right? So right before that, somebody had posted a question about staying calm and managing stress can be challenging when you have school-going children in the house. How to address anxiety and fear and cope with stress during COVID-19. Ibrahim, what are your thoughts? What do you tell your patients and your families about this? This is a great question.
It's a huge problem. The mental health aspect of it, it's a huge issue that we're seeing, especially, you know, because you're home, you know, you're alone with your thoughts, that type of thing. First thing is to know the facts and see, you know, exactly what we're seeing. And sometimes things get distorted, like you're saying, through the media. And so the vast majority of people, you know, get better, especially young people. The vast majority get better. And as of right now, we haven't seen a lot of long-term issues. Yeah, there'll be 1 or 2 or 3, a few people that'll have long-term issues with this, but by and large, it doesn't seem to affect people in that way, at least as far as we know. And when it comes to preventing any mental health, there's a few things. First of all, sleep. If you're not sleeping well, you know, you're just setting yourself up for a mental health issue. Number 1. Number 2, we talked about Iman and faith. You know, the world is overwhelming. There's a million problems out there. COVID is just one of them. And if you're not connected in with your faith, then, you know, you will get overwhelmed. And, you know, anxiety and depression, those kind of things are a result of it. And, you know, stress, when you lose your faith, you know, the common reaction is stress. You stress out, you start worrying, you can't sleep, you know, that also plays a huge role in how your immune system works. And then diet, we talked about that before also. You know, COVID's not stopping you from eating healthy. COVID's not stopping you from, you know, trying to limit the white powders, as we said, in your diet. And in people who eat healthy, we've seen across the board, you know.
I think just a nice reminder is that just because you're stressed doesn't mean you don't have Iman, and nobody's questioning the faith.
Oh, yes, sorry.
It's a part of life. I think we just need to remind people of that. Don't feel that because you're stressed or you're depressed during this time that your Iman is weak. Not at all. I think that
Sana, I think you're misunderstanding.
Oh, it's Manaf. No, I'm just making a comment about that. I think just a reminder to people that because that I think a lot of families do feel that, you know, oh, is my Iman weak because I'm sick, or is my Iman weak because I'm depressed? And I think we need to remind them, especially you guys who are in the front line with the kids, that remind them, no, that these things happen and we still have to do prevention and things like that. So I think I just want you guys both to remind people of that. And I don't want it to be in the sense of, you know, there's a lot of pressure that, oh, obviously you're depressed because your Iman's weak, and that's not a fair statement.
Agreed. No, I agree.
After 38 years of knowing each other, we begin, Shema, so Munaf and I just begin to sound alike, okay? Just
that's amazing. And
38 years, bro.
The other thing really quick I also want to mention is communication. You know, a lot of us struggle to speak with our kids. You know, a lot of us grew up in different worlds, different things, and we had different relationships with our own parents. And being open, talking to your kids, actually, addressing their problems that day, that week, that month, that year with their friends or other family members or school or all these other stresses. I think that's a huge thing that we don't do consistently. And I think that's something we should encourage and practice, because it's not going to happen right away. I mean, if you've never communicated with your child in that level, it's not something you can just pick up today and start doing it. It's going to take some work and actual, sacrifice on your part to get there.
So, real quick, absolutely. All right. Now, Munaf, kind of addressing your Iman, what it is faith. It's not Iman spirituality. It's faith in the process, in the system that you've come thus far. Why is Allah going to change all that? Or why is your circumstances going to change that because of a viral infection? The flu comes every year and ravages us, so what it is, meaning faith that it's going to be okay, right? And we know that faith-based medicine is very huge, from cancer treatment all to any treatment, right? If you have a positive outlook and a positive attitude, your recovery is going to be better. And yes, your immune system is much better. Absolutely. So that's what I meant by faith. Somebody had asked about zinc dosing. And, I think for children above like 1 year of age, 3 to 8 milligrams of zinc daily. Adults can take 10 milligrams daily. And, I typically take 100 milligrams once a week, but that's for me. I'm special.
Can you put that in chat, Shema? Because I know saying it is one thing, but maybe if you put it in the chat, people can read it. And
so I don't have time to, there's so many questions, and Shema Khan keeps asking all these questions. There's a lot of people logged in as me. I don't know.
Yeah, there are. I noticed that, but don't worry. We're all Muslim brothers and sisters. So, we all can't be Shema Khan, but we do want to be.
There's another question here about the people with O or O positive blood types, and if they have a stronger resistance.
Go ahead, sorry.
So I don't think there's anything that has been studied in terms of blood types and particular relation to COVID.
There are some studies, Shima, that they were talking about O positive and being more resistant, but they are pretty inconclusive unless Ibrahim knows something. And it has much more to do with the prevalence. There was some early study in China about the O positive versus O negative, and the prevalence was less, and part of it was that the people, they didn't have that many O negatives in China to begin with. So it's very inconclusive. So I don't think I would put my hat on a specific blood type and saying that this is the case or not.
There's a more recent study, I think somewhere out of Scandinavia, on blood types, and it's hard to extrapolate, and we're not gonna, I don't think it applies to us generally speaking, but they found that possibly the burden of disease fell a little bit heavier on non-O people. Now, again, it was a subset of population in somewhere, like I said, in Scandinavia, so it's hard to extrapolate. So we
tell people to be positive when it comes to these things, but I think that people misinterpret that being blood type. That's just okay. That's
be positive. There you go.
Okay, so one more question, and I think we're kind of getting to the top of the end of the hour. So it's a question about vitamin D levels.
So so I've been recommending vitamin D for my patients. Vitamin D has been shown to reduce the severity of some respiratory illnesses. So, and we're all deficient anyway, for the most part. So that's one thing besides the zinc that I've also been recommending for children.
So like dosage wise, would there be like?
So depending on the size and the weight of the child, really, but anywhere between 400 to 1,000 units a day.
Healthy diet. Stay away from the hot Cheetos and Takis. Your vitamin D levels will go up.
Yeah, but then we're going to be unhappy, and then we're going to be depressed.
But that's the balance. Common sense.
Hani, are we continuing this discussion next week? Is that what's on the plans?
Yeah, no, I would love to. Obviously, yes, for sure. And Sephora actually already has some plans too. And I think Dr. Altaf Kazi will be joining us too next week.
Oh, excellent.
Nice.
Right. So
Would you guys
parents-
be open to joining us again? I don't know if you guys, what your schedules are, but next Sunday, because there's a lot more questions I know, and then I'm getting texted and stuff too. So I don't know if kind of put you on the spot, but you know, if you guys are available next week, because I think there's a lot more to discuss still on this.
I would say that, yeah, I think I'm on service, but I probably will try to get on from my rounds. But maybe we can have like a talk from Altaf, and then the last 30 minutes just have questions and answer session. Maybe that may work better.
Yeah, because there's actually a lot more teachers want to join.
Yeah, and I would get, I think you can let Altaf know that, and we can just do a formal presentation just based on that, and then maybe have question and answer for like 30 minutes after that.
Right. So I had questions, so we'll answer them next time, but a lot about like what teachers should look for in children as well to get to the point where maybe they should consider sending them home. And also with sports activities, I know a lot of parents are concerned about whether we should, you know, enroll them in different sports.
Maybe instead of waiting a week, maybe Ibrahim and Shema can comment on just basic symptoms that the teacher should be concerned about. They may be better than instead of waiting the whole week. Guys, go ahead. Maybe, is it okay for a couple of minutes?
Sure.
I think the first thing that I would look out for, and I tell every parent, is if the patient is, you know, does not look good, looks very tired in appearance, is having a fever, that's the first sign. So any child with a fever that is looking a little bit more tired in appearance, alert the family and try to let the family know so we can do the right thing. That's all I would have to say. What are your thoughts, Ibrahim?
I agree. Treat the patient and not the.
I think this, Ibrahim, you want to put your symptom slides up, and maybe somebody can take a picture of that. That'd probably be a better thing for the teachers. Anybody who's got a cough, runny nose, cold.
Well, correct. Went off. Just real quick. The teachers, cough and cold do not mean that you need to look out for, right? Because we know we're entering respiratory symptoms. I think that the challenge here is fever, right? Fever is one of the ominous signs that we need to look out for. So for teachers, I would recommend highly keeping a vigilant, like you guys are doing thermal scans or temperature checks in school. If the child is febrile, we're already doing the frontline thing, right? We're meeting.
So are the teachers checking temperatures when they come in? I assume they are. And obviously if you are, then turn them around. And the kids are being masked when they're in class, or they're just in that little shields that they have?
As per the guidelines, they should be. I'm not sure about every particular school that's going on, but yeah, what are you seeing, Ibrahim?
They should be masked. Masks should be across the board, yeah.
But do you want to put that slide up if the teachers want to take a picture of that? But Shema made a good point. The fever is the biggest issue. I think you had a slide of symptoms.
I had a slide of symptoms from what you see in kids, and
Yeah, that's what I mean.
Fatigue, headache and sore throat and fever.
I
yes.
think the question was about what to look out in kids from the teachers.
Is it okay if we share your slides, Ibrahim, rather than trying to keep turning pictures and stuff?
Sure.
So
Yeah, that's what I meant.
Yeah, so Hani, that would be great. And I know you have the email list from the attendees. MashaAllah, there's a lot of great comments coming for you guys. Thank you. Excellent presentation and all that. Alhamdulillah.
Yeah, and for all our attendees, they're gonna receive an email with the recorded version of this too as well, along with the presentation itself, the PowerPoint. And I'm already getting so many emails from so many different, I have the ISOC executive admin office already thanking us for putting on this webinar. So I really appreciate
Islah LA is logged in.
Islah is logged in. So I really appreciate everybody's time and effort in this very informative webinar. Thank you so much again.
Yeah, are you guys, did you finish your slides, Ibrahim?
I did not, but we can continue next week.
Okay, yeah. Yeah, I'm sorry, but there's so many questions that exist with this, Shema. I know.
But maybe, are you okay to share the slides?
Yeah, absolutely. I'll email it to you.
For them, I think if that helps everybody. And,
yeah, that'll be very good.
I mean, I think you guys are.
It's very difficult, right? Because at a personal level, we're dealing with this at IAIOC right now, and
Yeah, no. I mean, my kids were just there 2 years ago, right? So I totally understand.
Yeah. So thank you so much, all of you, really, Manaf, Ibrahim, Shema, for coming on and sharing. And this is such a hot topic, I think, because we're actually having, major school issues, and I think a lot of the school teachers and principals are very, very interested learning from you guys. So
Absolutely. Absolutely.
And I
And
mean, I want to thank both you guys were in the front line, that you deal with things that, you know, I deal in the NICU. So appreciate what you have.
very, very informative, and thank you all for bringing your expertise. And also, you know, look forward to your presentation next week.
Inshallah.
Anything else, Hani, from you?
And we're good. Salam alaikum. Just
Okay, everybody.
Any other questions people have, or comments, or suggestions? Please leave them in the chat.
Yeah, leave them in the chat, and next week we'll inshallah.
And anything you guys want to know about as well.
And I guess, Shema, did you put the I don't know if Shema Salam, but did you put the dose, what dosages it recommends the kids? That's a really good one to have.
So yeah, I mean, I just typed it in the chat, but it's basically above the age of 1, 3 to 8 milligrams daily. And then adults can go between 10 to, I believe, a little bit higher, but I mean, there's no specific guidelines. It's kind of a wide range. It's all over the counter. You get something called cold ease, which are lozenges kids might like, but put it through the food. That's the best way to do it. Eat the right food.
Nah.
Yeah. No Cheetos, no chips. I get it.
Takis.
No Takis. Takis the biggest thing, right? Sana, thank you for letting me on the panel. I'm not the speaker, but thank you for letting me moderate. Thank you.
No, this is alhamdulillah, this is the good we can do for the community. Right?
The good news I'll tell you guys is the moms who have COVID, bad COVID, intubated, but their kids who are born are still okay, alhamdulillah. So that's one amazing.
Oh yeah, we didn't even touch upon the.
Next time, we can talk about it.
Okay. Assalamu alaikum.
Okay.
Okay, everybody. Thank you.
See you next week.
Got a dream in my life, yeah. I pray that it will happen. Devote all my time, yeah. More than you could ever know. I do it all with a smile, yeah. I go a million miles, yeah. In this world, I dedicate my life to just dream about it. In this world, I'll never be afraid to dream big about it. Come on, let's dream big about it. Dream big about it. Dream big about it. Dream big about it. If I didn't fly higher, then I could touch the sky. It's a really tough climb, yeah, but I'm aiming for the next line. I do it all with a smile, yeah. I go a million miles, yeah. In this world, I dedicate my life to just dream about it. In this world, I'll never be afraid to dream big about it. Come on, let's dream big about it. Dream big about it. Dream big about it. Dream big about it.
J. Dean, Harris J. Yo, I'm dreaming big about it. So many days and counting. I got a blessing in my life. I couldn't live without it. So that means that I'm never doubting. And that's every day. J. Dean on the track, got Harris J. It's your biggest dream, that means you gotta strive. I know you want it so bad, just make dua. Yeah, you want paradise, cause everything ain't about this worldly life. You want party, go club at night. Don't do bad things, nah, cause that ain't your type. Yeah, here's what you do. You gotta work hard, cause it's coming soon. So let me tell you one thing that'll help you through. Just know that paradise will come true.
Take you one day at a time. I know it's not easy to do. It's what I want most from this life. In this world,